Hello everyone, I am Dr. Tanvi Mahant and welcome back to my channel HomeoHeals. So in today's video we are going to talk about a hormone, that is AMH test, which a lot of female keep on asking me that how accurate it is, what does it tells about. Okay, so we are going to talk about anti-Müllerian hormone today. So a lot of females are delaying their conception and they are lot of questions and worry about their fertility and can we get pregnant about 35 and what does this AMH signify. So I'm going to answer all these questions in this video today. So talking about anti-Müllerian hormone or AMH, it is a blood test which tells you about your ovarian reserve. Now what do you understand about ovarian reserve? So when a newborn girl is born, okay, this follicle development or the egg development, oocyte development happen inside the womb of the mother. So during the month of 6 to 9 months, okay, the follicles are present in the fetus. So a newborn girl or baby is born with oocytes which are going to help later in the reproduction. So this follicles with which a newborn fetus is born or girl is born is known as ovarian reserve. Now this AMH test tells you about this ovarian reserve. That means how many follicles are present in your ovaries, and definitely when a newborn girl is born there are 1 to 2 millions of eggs, and as the age advances this eggs decreases. So after obviously the age of 30-35 the follicles or the eggs quantity are going to decrease, and that's how it's also going to reflect in your AMH test. So this what the AMH test tells you about the number of follicles, and as I mentioned, as the age advances the levels of AMH decreases. So now it is also very important to understand that AMH levels are high in cases of PCOS. Now a lot of PCOS patients come to me with very high AMH level. Now why does this happen? So in PCOS there are a lot of immature antral follicles. Okay, when you see a sonography, what happens, it is called as polycystic ovaries. That means in ovaries there are multiple cyst immature follicles and none of the follicle is growing in size and ovulation is not occurring. That is why these females also suffer from anovulatory cycles. Means what? Now for a normal ovulation to occur, okay, this primordial follicle or the follicle should grow in size, should pass to certain stages: primary, secondary, tertiary, and then the Graafian follicle. So when this follicle increases to the size of approximately 18 mm to 20 mm, what happens? Ovulation occurs. And in PCOS cases, okay, it gets arrested in the stage middle, okay, and there are multiple small follicles, none of them reaching to the stage of Graafian follicle for the ovulation to occur. And because of this immature follicles, it is reflected in the AMH levels, which could be high in females with PCOS, but in short it inhibits the follicular growth, okay, it inhibits the follicular stimulating hormone secretion. So in simple terms, okay, what I want to say is in PCOS cases you could see females with high AMH also, right? But again they are suffering from infertility or trouble to conceive because of anovulatory cycles, because of amenorrhea. So saying all this, okay, what matters for conception is also the quality of egg. Alright, and there are various other factors which depends on which fertility depends. So I have seen females with low or moderately low AMH also conceiving. Alright, so what I want to stress here is please do not focus too much on AMH levels also. Yes, definitely it tells you that your ovarian reserve is decreasing and you need to plan your pregnancy as fast as possible. with a lot of females going for assisted reproductive techniques, that is IVF, etc. In that also they check for AMH levels, which tells you about the quantity of eggs, alright. But saying all this, as I said, the quality is very important. So female with low AMH can also conceive even naturally. I have so many patients conceiving naturally with low AMH also. So this is a marker, you can say, which is a simple blood test which can be used to tell about your ovarian reserve, the number of follicles, but sometimes it cannot tell you the quality of your eggs, okay. And for that, a better investigation which is done is your antral follicular count. So basically it is a sonography which is done by your gynecologist or a sonologist on 3rd day of your menses, okay. It is a more reliable, more accurate biomarker which tells you about the quantity of eggs, again similar to your AMH. It also tells you about the quality of your eggs. So it is more reliable, but it requires assistance with a sonologist or a gynecologist, and you need to do a sonography for finding out your antral follicular count. But as opposed to that, AMH is a simple blood test which can also be done. So saying all this, I have seen a lot of females, okay, and couples getting worried in the beginning, in spite, okay, when they have not even tried naturally for conceiving. Just they are anxious because their age is increasing. So I would advise all the couples who are struggling with infertility, or they have a lot of misconceptions in their mind, that at least try naturally, okay. If you're about 35 years, try naturally for 6 months, and below that age, try naturally for at least a year. And if you're not able to conceive, visit your doctor, get yourself investigated, and definitely if you plan to delay your pregnancy, you need to get a brief investigation done of both the couples, okay, and see that there is no major issue. So this was a short video about anti-Müllerian hormone, what is its significance, what is ovarian reserve, and in short, I wanted to just educate females because there are a lot of questions about AMH and how reliable it is. So definitely it is a reliable test for your ovarian reserve and quantity, but that is not the only thing on which your fertility depends on, right? So there are various other factors on which fertility also depends on. So I hope this video was helpful to you all. If you have any questions, write down in the comment section. See you soon in my next video. Thank you.